We were
Yeah.
pro-government or anti-government. We were fighting amongst each other, and because we were
Hmm.
not actually in front of each other, it was easy to break off.
Right.
It was easy to stop talking and all that, and it was easy to abuse each other because we were not afraid of it. It was
Yeah.
easy to block. Okay, so today we are going to discuss the social and psychological impacts of COVID-19.
Hmm.
And along with that, we will discuss the interconnectedness, whether it has increased or decreased, and in what sense it has increased
Hmm.
or decreased. And
Okay.
then we will touch upon a little about the social media and its role during, especially during the COVID-19 period, where a lockdown and all was imposed. So
Hmm.
we'll be discussing all these topics.
ठीक है. सो स्टार्टिंग विद द पॉइंट कि कोविड के दौरान सबसे पहले मीडिया पे ही बात कर लेते हैं, क्योंकि मीडिया वाज वन ऑफ द एसेंशियल थिंग्स ड्यूरिंग द कोविड फेज. क्योंकि जितने भी न्यूज अपडेट्स थे, जितने पॉजिटिव नेगेटिव्स, even most of the YouTubers got initial boost in their performance due to lockdown. This was one of the, what you can say, the brighter side of COVID, कि लोगों को ज्यादा इंगेजमेंट टाइम मिल रहा था सोशल मीडिया से इंटरेक्ट करने का. उसमें दो पर्सपेक्टिव्स थे, एक पॉजिटिव एक नेगेटिव. उसमें ये थी कि न्यूज़ेस डिफरेंट टाइप्स की स्प्रेड बहुत तेज हो रही थी कि हमारी सरकार बिल्कुल नहीं कर रही है, फिर एक तरफ तक नहीं, सरकार ने तो वाइप ही कर दिया, बिल्कुल कतई औसम हो रखे हैं. ये दो पर्सपेक्टिव थे. दूसरा था कि जो क्रिएटर्स थे उनको एक अपॉर्चुनिटी मिली कि वो अपना और कंटेंट पे मेहनत कर पाए. इवन बहुत सारे क्रिएटर्स राइज हुए हैं ड्यूरिंग द लॉकडाउन फेज. इवन बहुत सारे बिजनेसेस जो मीडिया बेस्ड थे उनको काफी अच्छी बूस्ट मिली है. सो ये कंप्लीट फेज एक काफी अप्स एंड डाउन्स वाला था सोशल मीडिया के लिए. सो व्हाट डू यू गाइस थिंक वाज द एग्जैक्ट रोल ऑफ मीडिया इन दीस फेजेस?
So, see, when it comes to social media, people are actually, and everyone in general, are seeing that social media has been the real true hero. The
Hmm.
technology has helped us during the time of COVID-19 more than any god or religion.
Hmm.
Okay, that has its own thing, like it gives you mental peace and hope and all that. But on ground, technology has touched our lives more than anything else.
Right.
Even during with the help of social media, people were actually able to tell about the availability of beds,
Hmm.
availability of medicines and masks and everything else, and
Hmm.
they were able to communicate with each other in a better way. Like every
Right.
day guidelines were updating, and every day there were new guidelines about how to actually handle COVID and what to do
Hmm.
if you are at home. People
Hmm.
were in the time when you are going to be socially isolated and maybe in quarantine for precaution and all that, especially during that time, if there was no technology, I think the number of suicides that we have reported during that time, it would have been double.
Hmm.
It has
Okay.
there was no face to face interaction.
Hmm.
There was that, but still people felt that okay, someone is there out there who is going to support us if we need help. It's
Hmm.
not that we're completely alone. Social media has helped us in that way also, and
Hmm.
because people did not have much to do, content creation has risen, and both the cringe material and very good qualitative content has come out, which
Right.
again the positive and the negatives of the same thing.
Hmm.
uh, but during that time, but maybe because it's just a side effect that many jerks and perverts were also very active at that point of time,
Hmm.
cyberbullying has also increased.
Hmm. Okay. That's the
especially
dark side of the media
especially
during that phase.
especially girls have faced harassment online, and even the case number of cases registered was so high that they were not even addressed properly.
Hmm.
Okay, I myself have actually filed an FIR online
All right.
when I was actually like teased in a way. I won't say harassed, but
Yeah.
teased in a way by some random Bangladeshi. But there
Hmm.
was the cyber cell was not active.
Right.
Like they were not doing anything about it. I did it,
Hmm.
like my friend did it on my behalf. I did it from my own side, but there was no
No
response from
response.
their end.
Yeah. Hmm.
You can call it its Ministry of Home Affairs, चाहे जिसको बोल दो, कोई काम नहीं कर रहा था. This is one
Hmm.
of the sides where social media actually got darker. And there were spread of fake news. How can we forget that?
Yeah, exactly.
हाँ, आप गर्म पानी पीजिए, आप भाप लीजिए, आपका कोरोना चला जाएगा. आप ये करिए, आपका कोरोना चला जाएगा. And there were
Ginger.
like before it was actually stopped, and there was a counter that no, this thing is not helping much. It is only just like for your own relief. It's not a cure or a treatment. It's not going to cure you. जब तक वो message पहुंचता, तब तक it had covered almost lakhs of population of India, especially in the rural belt, and those all WhatsApp forwards that has actually created more panic.
Correct.
Social media has even created panic and helped anti-vaxxers in a sense that they created a kind of like they demotivated the general public and scared them that it is going to cause a lot of side effects and you will be hospitalized and you may even die. The worst case scenario. So there was a lot of fear created among the general public who is not so literate about all these things. Right? So there are so many aspects to it, but social media, we cannot forget that it has kept us connected to some extent and has helped us in helping our own loved ones. Like my father was not even here. So when he was at some other place and he got COVID for the second time, it was all social media that we that helped us. WhatsApp and through online we help him and all that. FaceTime and all. So all we could be there with him was through social media, and this was the case with many other families also, whose family members and loved ones were in isolation or in quarantine for like 15 or more than that days.
Right.
This is one
And
aspect.
even referring to
Social media
the
has actually come out as a true hero in many sense.
even in the current situation where a war is going in Ukraine and Russia, all of the updates, the real ground updates we are getting through is media, basically, because all of the world is knowing what's happening exact in those grounds, even though we are not there. And still, the positive and negative aspects are there. But if it was a war in, let's say, 60s or 70s, we won't be able to get the latest updates and all of that stuff. But now we are currently updated, and we are in a way protesting or supporting whatever we are doing. We are still connected with those two nations that are so much away from here. So yeah, this is the bright side that we can say. And even in the coming future, we can say that media is going to play a very huge role in manipulation of the minds in the ways we think, because we all know that the algorithms are now tracking our behaviors and activities that we are doing online. So yeah, it is a very crucial aspect that
Yeah,
every
it has
government.
been actually a period. Corona lockdown actually has been a period of indoctrination of some or the other form. Because we were exposed to so much of content online. We were into it because we had nothing to do. So it had a lot of impact on our brain.
Correct.
Negative or positive, or it has indoctrinated it in indoctrinated us in some or the other way. We were pro-government or anti-government. We were fighting amongst each other, and because we were not actually in front of each other, it was easy to break off.
Right.
It was easy to stop talking and all that, and it was easy to abuse each other because we were not afraid of it. It was easy to block. So all those things, it has actually changed us a lot.
Okay, very well articulated by Nishtha, but I have a slightly different take on this whole pandemic and social media thing, right? I think what it has done is this has exposed in a sense, this has exposed how actually money can manipulate things, especially in the sector of medicine and public health. For example, WHO, right? I mean, it could have done many things. They could have alarmed the world way before, right? It was the quote unquote Chinese money which was keeping them shush, right? Second thing is, it also exposed the nature of the big tech companies, right? How they can censor things, right? Although they become the champions of freedom of speech and democracy and whatnot, but actually they are very good at censoring things.
Mhm.
You remember when the first COVID wave hit in the world, what these companies did was actually, if someone even remotely talked about this could be a potential leak or something of that sort from the Wuhan lab,
Mhm.
these social media companies, they went out of their way to censor that content. Right?
Yeah.
This is manipulated thing. And
Mm.
cut to next year, when there was some publications and scientists sign some documents saying this and that, they were okay with that. See, now that didn't become misinformation, and 1 year back that was misinformation or fake
Mm.
news,
Mm.
right? So I think it has more and more exposed the loopholes in the system and how these loopholes are used in a sense, to create a kind of narrative, or let's say an opinion,
Mm.
right? If you have money, and if you are willing to uh, buy these people out, they are willing to sell themselves, right? And
Mm.
then they will create any kind of narrative which may or may not be based on facts and logic, right?
Correct.
I think in social media has then, apart from whatever people grew on social media and they were learning cooking and they were studying online and things like that.
Yeah.
Apart from that,
Yeah.
I think for me, what it has exposed is this hypocrisy prevailing in the global systems,
Mm.
especially in the domain of public health.
Correct. So, this was one aspect of the complete lockdown phase. Now, talking about the other psychological and mental effects that we all faced, especially if I talk about myself, I faced a lot. I gained a lot of weight. I went through a lot of health problems, and same goes with a lot of professionals and people who were habitual of going outside and executing their work in daily routine, but all of a sudden they faced the boundaries of their own home and they were not allowed to move, and that created a lot of mental impact, including depression and all other kind of stuff that was not even planned or not even familiar to them. So I guess it was a very tough period for all of the individuals in India, specifically in India, because when in the if you guys remember the second wave, when it was extremely high, like 3 lakhs, 4 lakhs cases per day, we were not being able to move even. We were not allowed to move even outside of our house for basic needs because we were so scared.
There was a direction given to many of the individuals, and there's so many people who have done so many courses during that period, and
Correct.
even online degrees,
Yeah,
right?
right.
You're even there's people who have done these degrees online through foreign universities.
Like
So
Udemy.
yeah, not
Yeah, but yeah, we can we can say
I'm
that it's
actually talking about doing a foreign
yeah, right.
going to a foreign
I get I get
not Udemy course.
but still
So
it's the
ये लोग
relevant.
किया है actually. Even when I was in Cognizant, people were training me through Udemy only.
Hmm.
तो सस्ते भी होते हैं and they are of no use also.
By the way, this video is not sponsored, guys, so don't misjudge us. It's
I
just
am completely criticizing that, so definitely not sponsored or something.
yeah.
So it was completely different experience for me. There were times when I felt isolated, lonely, depressed, and all that. But it was part of the whole. Everyone was going through it,
Right.
so I never felt that I'm alone. There
Hmm.
were so many people who wanted to talk about their emotional needs, like even I wanted to. That
Hmm.
I companionship in even online. There were so
Yeah.
many people who wanted to talk, even strangers. But the
Hmm.
experience were actually mixed, good or bad.
So I think, yeah, as Nishtha very well pointed out, ki it has been very different for different people, considering in what situation, in what circumstances you were when the first lockdown actually happened. For example, for me, 2 or 3 days before only I went back to my home, and fortunately I live in a village, so that's a thing. In village, the you can actually, you had pretty let's say to a degree you were more having more freedom than compared to people who were living in urban cities and things like that,
Yeah.
right? Because you have ample of space to roam around and things like that. So in that sense I was relieved. But
Hmm.
yeah, it actually pointed out something again. I would say something very different for me, right? I
Hmm.
saw actually the stark divide in the India, right?
Hmm.
Divide in the sense the digital divide that exists between India. For example, if you are from a very not very well off, but also from a middle class background, you
Hmm.
could have afforded people your children education, right? For
Yeah.
example, through mobiles, laptops, tablets, whatever.
Hmm.
But what I saw was actually the people who usually study in these government schools, they didn't had access to any of those. And for 2 years straight, there was no teaching done to them. I mean, yeah,
Their
in some
education was
phases or what,
lost.
yeah,
Hmm.
in some phases, 1 or 2 months, I think it was open, but again, it was closed to considerably, considerably 2 years of their life has gone. Study life
Hmm.
has gone, I mean, in a sense.
Hmm. Hmm.
Uh, But for the people who were studying in the middle class who go to convent school or let's say CBSE schools, uh, their father and mother, although impact has been on them also because of if there's the let's say even if the one parent lose their job, right, lost their job, uh,
Yeah.
impact was there. But people somehow manage. But for ruler hand to mouth people, right, who live on a daily wage,
Hmm.
it was very let's say it was very in a sense disastrous and catastrophic for them because
Disturbing.
on the one hand, okay, government did provide to a certain extent the rations, right, the rice and the oils and things like that,
Hmm.
but their children couldn't go to school, nor did they have the money to actually get their children a phone or tablet or whatever, so they didn't have the education.
Correct.
So they regressed in a sense, right? And
Hmm.
that shows
Hmm.
actually the digital divide in India. So
Right.
that's the
And
thing.
इवन विद द मिडिल क्लास फैमिलीज इन द पीपल हु लॉस्ट देयर जॉब मतलब उनके लिए काफी हार्ड हो चुका था कि उनको दोबारा एक सर्वाइवल मोड पे वापस आना क्योंकि वो फिर कहीं ना कहीं रिलायंट हो गए थे अपने सेविंग्स पे या व्हाट यू कैन से एनी वन मेंबर हु वाज अर्निंग स्टिल क्योंकि जो जिन लोगों ने अपनी जॉब लूज की वो ऐसा टाइम नहीं था लाइक नॉर्मली जब हम जॉब चेंज करते हैं तो वी टेक अ क्वेश्चन ऑफ 1 or 2 months for the bracket to fill with another job. But there were times where people were unemployed for 6 months, 8 months, even for a year during the whole COVID phase. And it was not just a single story, it was a story of thousands, even lakhs. So I think this made a huge impact, especially in middle class and the people who were earning in private sectors, because we all know that government sector is much more safer. But the people who were earning like salespeople, the people who were in on-ground activities were affected the most, I believe, because the people who were in technical jobs were somewhat safe because they had the option of working from home. But the people who had the hardcore job of going on grounds or let's say doing the work that is not possible on laptop screens were suffering a lot. That what I observed, especially during that phase.
Yeah, and the second thing in this was actually keep the nature of the relationship, like the personal relationship, like for example जो पिता का पुत्र से जो रिलेशन है या माता
Hmm.
का जो अपने पुत्र या पुत्री से या किसी जो भी परिवार में है, इट एक्चुअली जो जो डायनेमिक्स थे वो काफी चेंज हो गई. यू वर काइंड ऑफ many people you know uh, suffered from anxieties, right?
Hmm.
They were not uncertainty was a very great was to a very great deal, right? Because अगर तुम देखो तो किसी को ये पता नहीं था कब एंड होने वाला है. Nobody
Correct.
knew.
Hmm.
And
Hmm.
किसी को भी especially in the second wave I think there was not a single person जो अपने किसी फैमिली या दूर के रिश्ते में नहीं जानता होगा किसी को जिसकी या तो डेथ हुई हो या
Yeah.
जिसको कोविड हुआ, especially in the
Hmm.
second wave. First wave it was
Hmm.
not so much, but second wave it was there, right? So the uncertainty, your dynamics, you were stuck with same kind of person, and जो जो डायनेमिक्स से बहुत चेंज हुए हैं, राइट?
Hmm.
फॉर एग्जांपल वी नो वी नो थ्रू डेटा कि डोमेस्टिक वायलेंस के केसेस इंक्रीज हुए एक्चुअली ड्यूरिंग द
हाँ.
पैंडेमिक, राइट? देन सेकंड थिंग वाज कि Okay, some people got close, but overall, what I think was कि somewhere relationship got strained
Hmm.
in a sense. That's not only because you were stuck with the same individuals for a prolonged period of time. That's also has to do you were not allowed to move anywhere, right?
Hmm.
And
Hmm.
the kind of uncertainty that pandemic generates, especially in the second wave when you were hearing about people dying and catching COVID, so it also creates let's say a kind of
Kind of
fear,
mental
right?
hunting. Yeah.
No,
Hmm.
a kind of fear ki,
Hmm.
what will I do if so and so person does not remain in my life, right?
Correct. Hmm.
Everybody got that fear, right?
Hmm.
So I think it was more troublesome. Relationships have gone through a lot of changes, right? The dynamics have quite changed.
Hmm.
Some people actually started valuing what they have more. Some people got really strained by this because
Hmm.
let's be honest, if you're not allowed to move and you are stuck with same individuals for 2 years, right, it would you know create some sort of problem.
Correct.
As you rightly pointed out, there are many factors to it, not just one or two. Like, if you're in a lockdown, and if you're especially from a low income background, obviously
Hmm.
you're not having separate rooms for
Yeah.
every,
Right.
right?
Hmm. Hmm.
Especially kids.
Hmm.
When it comes to child abuse, child abuse can be of both the types, the mental and the physical. And
Hmm.
talking about the mental, the intra-parental fights that they see is a
Hmm.
kind of abuse to their own mind, and eventually it can lead to they themselves harming, doing self-harm, right?
Yeah. Yeah.
It can happen. And
Hmm.
obviously, if you do not have any channel to vent out your frustration,
Hmm.
for Indian parents, kids are the easiest way to let out your frustration. You beat them, abuse
Yeah.
them,
Yeah.
and you even mistreat them sometimes, and it is
But.
not healthy for the child. And because your social mobility was so constrained that you cannot
Hmm.
even go out, or even like one person is going out, it has a he or she is given the responsibility to go out and get the groceries or anything
Hmm.
else. Rest of the
Hmm.
people stay at home for the precaution purpose.
Hmm.
Then
Hmm.
the social mobility is so much restricted. It
Right.
has impact on children also, because they cannot always be on phones, and
Hmm.
they have to do their studies also, and that too they are not getting properly in
Hmm.
online
Hmm.
classes.
Hmm.
The interaction that we have in class, the face to face interaction has been decreased so much because
Hmm.
of social distancing and all that, that there is a kind of sense of emotional loss, in the sense that you feel that your self-worth is losing.
Correct.
You're
Yeah.
not able to explore yourself to your fullest potential. You're
Hmm.
not able to put yourself out there. This is very important in case of children who are in the growing age,
Right.
because they are the ones who are going to like experience a lot in life during this phase. When it comes to adults, if you have a pre-existing psychological disorder to get aggressive, that's
Hmm.
one. You will definitely be violent in such cases.
Yeah.
Otherwise, because of these conflicts being amplified, because you have this congestion in home, this lack of mobility
Hmm.
and space that you are not getting, because of that the conflicts have been amplified. There
Hmm.
has been economic stress, loss of job, prolonged unemployment, and
Correct.
then whatever little problems that could be avoided by giving a space to each other in when it comes to couples,
Mm-hmm.
even that choice was eliminated completely.
Hmm.
It has given a kind of space for domestic violence to increase. National Commission of Women have actually recorded more cases during lockdown than they have in the last decade, 10
Okay.
times. And
Okay.
even they were not understanding what is the proper reason for it, that they
Hmm.
are reporting so much. And
Hmm.
globally it has increased, it's not just in India.
Yeah.
And
Yeah.
only like 20 to 30% of the victims of domestic violence have been given attention by the health workers, because then every zone was a corona zone during that
Yeah.
period. Even
Right.
heart patients were not getting proper treatment, other illnesses were not taken care of. So psychological disorders or any kind of domestic complaints were actually sidelined.
Right.
There was not proper infrastructure to actually address these issues. They were whoever was there, everyone was actually dedicated for the service of
Hmm.
COVID patients. So
Mhm.
these topics were not even touched, and the victims who are actually getting physical injuries, even
Hmm.
because they cannot go out, they cannot most of the time complain,
Right.
and it's not possible, or it is not even a choice for many of them to complain. They have to
Hmm.
be.
Hmm.
Same with sexual abuse.
Hmm.
uh,
Right.
like if you have a very toxic or non-understanding partner, he has got all the freedom now, because you cannot go anywhere. Every
Hmm.
time you pick up a phone, there is a suspicion that whom are you calling, and
Yeah. Yeah.
that is there. And there's so much of lack of freedom for
Hmm.
women in such cases, that
Right.
they also fear that what will happen if I complain and people know it, but no one comes to help afterwards.
Right.
They
Right.
only make nuisance about it, but they do not solve the problem for me. It will make it worse, and the
Yeah.
other person will beat me more.
Exactly. Hmm.
That is the fear. And you will see that because if you have abusive partners, they will avoid any kind of contraception, or it will eventually lead to unplanned family
Hmm.
in
Yeah.
future pregnancy.
Hmm. Hmm.
So uh, sexual abuse, marital rapes, and child abuse, everything has gone up.
Hmm. Right.
And still there's no, what do you think if something this terrible has happened to me just a year back? What is the impact of that situation 1 year later? Does it go away?
No.
It doesn't.
Definitely not. It is
The
like a
scars
scar
can
that stays always.
go away on the body, but
Hmm.
the mental scars remain there, and
Exactly.
still there's no proper help for it.
Hmm.
They are bearing with it, and there's no kind of data
Hmm.
available from the government sites.
Hmm.
Whatever we get to know with the help of NGOs
Hmm. Right.
that are reaching out.
Hmm.
And this there was a survey done in this
Okay.
in a starting period only.
Hmm.
uh, the date was I think April 2020. It was
Okay.
done in during that period. The portal was open. The survey period was that 1 month. There were
Hmm.
1,871 responses that were collected,
Okay.
and then so 74% of the people actually reported that they have stress among
Okay.
that,
Hmm.
and 71 told that they are suffering from poor well-being. They are not being properly taken care of in their households.
Okay.
And then 40.5% either had anxiety or
Hmm.
depression,
Okay.
moderate to severe levels.
Hmm.
And this is only a sample of 1875 71.
Yeah.
I am completely sure, even if would have expanded to thousands, 50,000 or 1 lakh, the data would have not changed when it comes to the stress or the anxiety levels.
Right. Right.
Everyone was feeling emotionally
Hmm.
uninvited, and
Hmm.
because there's a lack of understanding of the fact what is the difference between stuck at home and being at home.
Being at home, right?
Yeah,
Hmm. It was
safe
more
at
of a
we see
being
you're
stuck
safe
at the
at
home.
home, but
Hmm.
sometimes you're stuck at home for many
Right.
people.
Hmm.
So the lack of understanding about these two things, and the lack of emotional quotient that we as Indians show in
Hmm.
general,
Hmm.
even to our own family members, sometimes I will include myself in that,
Hmm.
that
Hmm.
you cannot always tend to emotional needs of your own loved ones. You cannot,
Correct.
because you yourself are so much stressed, and also you do not know how to handle the situation,
Right.
and you're so hesitant of
Hmm.
taking any kind of professional help,
Exactly.
right? Because you do not trust the person. He's a
They are not
stranger.
habitual of
You're not
taking.
happy, you're not
Hmm,
comfortable also, and then you
hmm,
do not want to kind of spend that amount of money
money
for
for
something
just a
like this.
consultation.
Yeah,
Hmm,
you do not want to. Even
hmm,
a normal a good psychiatric consultation charges you anywhere between 800 to 1200
1200, right?
one sitting.
Hmm,
People were so economically and financially stressed during
hmm,
that time.
hmm.
They will never think of taking professional help if they do not have money, spare money.
Yeah, right.
Okay,
Hmm.
they have so many needs, and everyone was like, get health insurance. Okay,
Now
the
is the
amount
time.
of health insurance that have been taken during that period have actually gone up. People
Hmm.
like, no one is going
Yeah.
coming to help. We will have to go to private hospitals. Government hospitals are filled, or they will not
Hmm.
give you the facility. Ventilators are costing so much. So they even in maybe in panic,
Hmm,
or
right.
maybe they got financially literate.
इस इवन
Any
इवन उसके इवन उनके एड्स भी ऐसे होते थे ना कि अगर आप अभी नहीं तो जिम्मेदार बनिए अभी नहीं लेंगे तो आपके फैमिली के बाद आपके बाद कौन देखेगा मतलब they were picking the nerves of the people the
yeah,
insecurities and
I myself took the health insurance during that time, and the next
okay
year my father and the mother also took, and my father was the one to force for it. Go
okay
take. It's necessary, होना चाहिए.
hmm
तो ये भी था. So what has caused the cases to rise is
hmm
actually the lack of space, the increased financial loss,
hmm
uh, and unemployment, prolonged unemployment. There's no one to actually bring bread at home, which amplified the conflicts,
hmm
and the things that could be solved with the help of space, giving space to each other, was not present. And whatever the things are there which need some change of place, and going out and performing and living your fullest to your fullest potential, in case of children, even
hmm
that was absent, which made even them stressed and emotionally drained completely.
yeah
You can say that sitting here, I may not be mentally so active or sharp
hmm
compared to going somewhere, performing something myself, or experimenting something myself. The kind of experience and mental strength that I will gain there will
correct
be more compared to what I
this
am gaining here reading some novel. That is also necessary. I'm not saying
exactly
that's not
hmm
necessary,
hmm
but going out is just so much necessary. And
correct
this social distancing thing has actually led to loss of your own emotional, what do we call it, worth. You want to remain aloof now. You
right
are not comfortable sharing your feelings. This
hmm
has happened to a lot of people. There were
exactly
many introverts who have got even more introvert after this. They were
hmm
very happy
hmm
that, okay,
hmm
lockdown. Not the case with everyone, but yes.
I would just like to mention a point here, right?
hmm
Uh, 370 million
hmm
children
hmm
who were a part of midday meal scheme. The school
hmm
closed down for 2 years,
hmm
right?
hmm
And they were not getting their foods.
hmm
And according to estimates, some 6 lakh more students have actually 6 lakhs or 3 lakhs students have actually increased in child wasting, which is also reflected in the NFHS 5 survey, right? Which has been done, right? Child wasting. Then there is a problem of malnutrition because these people were enrolled in the midday meal. Okay, you can say it's flawed and things like that. There is
hmm
उसपे इल्जाम भी लगते हैं मिलावट and things like that, but still they were providing milks and things like that. But
yeah
what has happened is this lockdown was imposed and the schools got closed, and so their nutrition portion which was covered by the midday meal scheme was not there. Right, so
hmm
that has improved. The I think the malnutrition has increased from somewhere between 10 to 50%, right, compared to
yeah
the previous level. I
hmm
mean, nobody pointed out actually this. Actually, this was also an impact of that.
right so concluding all of these points I guess all of the crisis that we faced it it helped us to become a better person in the ways like what to exactly follow and how to value our things, how to value our relationships. I'm specifically talking about the people who were in the, let's say, middle class, upper middle class in those days, because in the poor class, as Nishta mentioned, that there are a lot of problems during the lockdown, so we can't say that all of us were happy and all of the things just went good. It's not like that. But the people who were sensible enough were able to understand the importance of the things that we have and how to exactly plan out different things for ourselves. Some of us even got us new streams for studying and all of that, as we mentioned earlier. So yeah.
Fine.
Hmm.
Like, I talked about the places that were poverty stricken.
Hmm.
So
Hmm.
it's a condition that there is close contact, there's
Hmm.
social isolation also that has
Yeah.
reinforced the domestic violence. But in
Hmm.
cases where you actually had your space, like in upper
Hmm.
middle class, the elite
Hmm.
class, the
Hmm.
issues were completely different. They were
Exactly.
much more psychological stress than anything else. And there
Yeah.
were people whose businesses were hit.
Hmm.
That was one of the reasons. And suicides, I never talked of suicides. The suicides were the maximum in the migrants
Exactly.
during all that
Exactly. That's
migrant
the.
crisis.
Hmm.
There was a survey again done, research. There was a research paper by law university students of Bangalore.
Hmm.
The data was taken from various newspapers. So between March 2020 to July 2020 alone, there were 122 suicides.
Okay.
Majority were male, and they belong to the age category of 31 to 45 years.
Hmm.
And major and the major thing about it was the fear of COVID infection, the major cause. Can you believe it? The
No.
fear itself has led people to suicide, that they won't be able to handle it.
Hmm.
And even if they got it, so they were like, ab main nahi bachunga, kind of.
Yeah,
And
that was the.
I was so shocked reading about this, that the major cause was not personal stress, emotional stress, or financial loss, or
Hmm.
these were factors also among other suicide cases. But the major cause was the fear of the infection itself.
That's
Yeah.
simply taking the guard down and let's say, what if
That
this happens?
also points out how government was not able to assure people. There was so
Hmm.
much panic created in the beginning,
Yeah. Hmm.
right? And
Hmm.
when you talk about being a good person, I think only one good thing that has come with it, that we now Indians know how to use sanitizers and masks and keep social distance.
Yeah,
Even
I can
that,
clearly
in
see
many cases, we could not
that.
do. That is
But
the only good thing. Otherwise, when it and yeah, people have started talking about mental health a lot, but
hmm. Hmm.
there's no mechanism on part of the government to address these issues, and helplines are very less. No one is like, you're getting response. It's like, I am feeling suicidal today, they may
Hmm.
respond tomorrow, and there's no
Yeah.
use of it.
I
So
remember पहले ऐसी
this
होती
interest
थी
is
लाइन,
completely
राइट?
distorted. Huh?
पहले एक लाइन होती थी जहाँ पे एंटी स्ट्रेस करके एक नंबर होता था, जहाँ पे होता था कि अगर आप ऐसी फीलिंग अगर आप पे है तो आप इस पे एक कॉल कर सकते हो एंड वी विल असिस्ट यू
Parents
प्रॉपर्ली.
भी होनी चाहिए ना.
Hmm.
Who were the major victims of suicide during the lockdown? Migrants.
Exactly, and they
कौन
were
होता
not.
है किसी
They
तरह
will. We
की,
never be aware of these programs, right?
जो पूरा डिस्कशन भी है of the sociological and the uh, psychological impact of this
Hmm.
whole thing is actually limited to a section of the society, and it
Hmm.
doesn't touch the poverty stricken or economically stressed people who are actually on the verge of breakdown.
Correct.
They are left on their own. If you
Hmm.
ask and see, the ground reality is that we are
Right.
here in the comfort of our homes. We are able to talk about it and even do a podcast.
Hmm.
They might not even have the luxury to talk about it, because the priority for them is whether we get the food in the evening or not.
Correct. Correct.
They cannot actually take the luxury, sit and talk about it like
Hmm.
we.
Right.
and the majority who are actually committing suicide is the male population, which again tells you that unemployment and financial stress has been one of the major factors during
Right.
this.
Um, I think what it has done is it has once again exposed the chaotic system which exists in our governments, right? Not
Hmm.
only India, in all over the world with regards to the lockdown policy,
Uh,
right? Um, there are reports which clearly suggest actually lockdown is not in a way very effective, right? Then
okay.
also, and then also, especially in India, we have imposed lockdown and curfews from 10 to 6. Tell me
Hmm.
what is the rationale behind it?
नाइट कर्फ्यू
Yeah,
रात
tell me
को
what is the
करेगा.
rationale behind it?
I don't know. Maybe
वो
the
रात में
logic.
निकलता वो बैटमैन है,
Hmm, hmm.
खत्म।
वो
इंडियन
सोनू
There is
निगम की
no
लॉजिक था ना कि
रात
वो
में निकलता।
12 आवर्स में कोरोना डिसेंट वो हो जाता है डिसएक्टिव, तो 12 जो पहला लॉकडाउन लगा था तो उन्होंने कहा था बहुत अच्छी स्ट्रैटेजी है ये, कोरोना खत्म हो जाएगा 12
अरे
घंटे.
शुरू शुरू में तो हम लोग गवर्नमेंट को सपोर्ट भी कर, चलो कहीं तो रुकना बंद करें, कभी कहीं तो निकलना बंद करेंगे, बिकॉज पीपल वर नॉट इवन लिसनिंग। चलो ठीक है, रात में तो मान लो कभी तो मान, पहले तुम कर भी रहे थे, बट व्हेन इवेंचुअली व्हेन वी पास दैट स्टेज कि अब इतना इन्फेक्शन नहीं फैल रहा है, तो हाँ एवरीवन थिंक्स कि अब ये क्या लॉजिक है इस बात का। बैटमैन हो।
Even in the third wave, firstly night restrictions were imposed. मैंने कहा ठीक है भाई, अगर कंटेन नहीं करना है तो 2-3-4 दिन का मेजर कर लो, उसके बाद छोड़ दो. Well, that's another thing. I'm not an expert, but
प्रॉपर लॉकडाउन फॉर 1 वीक,
exactly
जब तुम्हें इफेक्ट
that
पता चल जाएगा।
right. Containing it in night, it doesn't make any sense. Maybe we are just not educated enough to understand that logic that those people are making out there in the center. But anyways,
not not only that, the sweeping powers the people in the authority in the government got, right,
hmm,
with this pandemic and it was massive. They could have, there needs to be a survey ki how much of the freedom and things like that was taken. I'm not talking specifically in regards to India. It has happened all over the world. Right?
hmm,
The people who are in the government, who have the authority, right? They
hmm,
got sweeping powers
hmm,
due to this pandemic. And freedom was not in a way very much respected. Even in the countries which we call the bastion of the liberalism,
hmm,
there also
hmm,
this happened, right? So I do not know how do they rationalize these things. I mean, they do not have an iota of what you can say introspection. We need to change things and like that. Right. So I mean, it has exposed. I mean, the lockdown rules. I couldn't get my head around it. Right. How
hmm,
come they have formulated such a policy
hmm,
when they, reports after reports, articles after articles are saying that lockdowns are not effective. Let
hmm,
people work, right? But no, we have to some way show that we are working,
Some extent
even
they
though
it has to work. It cannot be
hmm,
that it's completely ineffective.
yeah, lockdowns
no one
can't
is
be
saying.
blamed because see, ऐसी थी ना
No, I'm
problem.
not blaming.
Hmm,
Now
hmm,
let me complete my point.
hmm,
I'm not blaming lockdowns. In first and second wave, it was fine,
hmm,
but the lockdown was continued till this year, right?
hmm.
And if you are implying either to imply full lockdown, what
Yeah,
is
right.
the rationale behind 10 to 6 lockdown? Tell me the
Hmm,
rationale behind it. Most of
hmm,
the people do not, even in the cities, do not go after 10 or 11, right?
hmm, hmm.
It may be the party animals and things like that who may wants to be going out, but for
Hmm.
most individuals, they come home by 10,
Right.
wherever they are, right?
Hmm.
Most people who are in families come home. So
Hmm.
what is the rationale behind it, right? I'm talking about there needs to be a coherent policy about it, right?
Hmm.
I didn't see any coherence. Okay, you
Right.
can blame people if people are like this and that, right?
Hmm.
I'm not saying people are very responsible in India or anywhere in the world. You see the kind of anti-vax movement in Western
Hmm.
countries, right?
Hmm. Hmm.
Fortunately, in India we do not have such type of people, right? And that's a great news.
Right.
But I think there needs to be a rationale behind imposing lockdowns, right? I didn't get the rationale behind 10 to 6 lockdowns. I'm sorry.
Right. So I guess we can discuss these what you can say core topics in any another episode. I guess uh, today the main topics are covered, and we'll keep continuing new episodes in the coming weeks. So sorry for discontinuing, but in the coming time we'll be quite uh, punctual with our episodes, and new topics will be covered. And so stay tuned. And if you like the content, make sure to
पंचुअल तो नहीं
subscribe and
होगा,
like.
ठीक है? पंचुअल तो
Yeah.
वैसे भी नहीं होता, ये मिलने वाला है, बकवास नहीं करता.
I was shifting and
See,
changing, guys. So
it
do
is
it
the
when we actually like
problem on
to
the
do.
side of Anubhav.
This is the truth.
It is problem on the side of Anubhav. It's not on the my side. So I am not to blame.
I take the responsibility.
He wants only trendy topics. You can't help it.
Yeah.
चलो मैं